Fetal monitoring. A common way to determine how a baby is responding to labor is to use an electronic fetal monitor. This device measures the baby's heart rate and the character of contractions simultaneously.
All right, here are your contractions here. They're about 5 minutes apart. They're lasting about 60 seconds. And simultaneously, we're seeing the heart rate. The heart rate is printing out right here, and that will show us how the baby's tolerating labor.
The most common type of electronic monitor is worn externally. 2 belts are wrapped around your abdomen. The top belt holds a pressure-sensitive device which responds to the shape of your uterus during and between contractions. The lower belt holds an ultrasound device which measures the fetal heart rate. Fetal distress can be detected quickly using this machine. So that you can move around freely during labor, electronic fetal monitoring is usually done intermittently rather than continuously. Your doctor or midwife may need a more precise assessment of fetal well-being than an external monitor gives. In that event, an internal monitor with electrodes that attach to the baby's scalp and inside the uterus may be used. IV fluid. 2 reasons for having an IV in labor are to replenish fluids and to keep a vein open in the event that medications must be given in an emergency. In some hospitals, IVs in labor are routine, but increasingly women are drinking clear fluids or eating ice chips to stay hydrated. Episiotomy.
Probably I'm going to need to cut a little episiotomy, okay? Not for sure, but I think probably.
Episiotomy is a surgical procedure done to enlarge the vaginal opening just before a baby is born. It may be necessary if there is fetal distress in the late pushing stage, if the pelvic floor is unyielding, if forceps are used, or to prevent a spontaneous tear. The vaginal opening is enlarged by making an incision from the vagina toward the rectum, directly back or off to one side. The incision is stitched under a local anesthesia after birth. Episiotomy is practiced widely in the United States. Many feel it can be avoided if efforts are made to ease the baby out slowly. Warm compresses and lubricating oil help to stretch the vaginal opening gradually. Good coaching and support from your caregivers during pushing and utilizing an appropriate position may decrease the need for an episiotomy and the likelihood of a tear.